Dermatology, skin disorders. Two common skin disorders are eczema and acne. Eczema is an inflammatory condition that occurs in individuals of all ages. Acne involves the clogging of pores, which can lead to infection and inflammation, and is often seen in adolescents. Other disorders include seborrheic dermatitis, or on the scalp, psoriasis, fungal infections, cold sores, impetigo, scabies, hives, and warts. Eczema. Eczema is an allergic reaction that manifests as dry, itchy patches of skin that resemble rashes. It may be accompanied by swelling of the skin, flaking, and in severe cases, bleeding. Symptoms are usually managed with moisturizers, corticosteroid creams, and immunosuppressants. Acne. Acne is a result of overproductive sebaceous glands, which lead to the formation of blackheads and inflammation of the skin. Acne is a skin disturbance that typically occurs on areas of the skin that are rich in sebaceous glands on the face and back. It is most common along with the onset of puberty due to associated hormonal changes, but can also occur in infants and continue into adulthood. Hormones, such as androgens, stimulate the release of sebum, and overproduction and accumulation of sebum, along with keratin, can block hair follicles. This plug is initially white. The sebum, when oxidized by exposure to air, turns black. Acne results from infection by acne-causing bacteria, such as Staphylococcus and Propionibacterium, which can lead to redness and potential scarring due to natural wound healing process. Ringworm. Tinea, or dermatophytosis, is often referred to as ringworm. Ringworm presents as a circular rash that is itchy and red and can be found on various parts of the body. It is referred to by the location that it is found. Tinea pedis, or feet, or commonly referred to as athlete's feet. Tinea capitis, or scalp. Tinea barbae, or beard. Tinea manum, or hands. Tinea unguium, toenails or fingernails, also called onychomycosis. Tinea corporosus, body parts such as the arms and legs. Psoriasis. Psoriasis is a chronic autoimmune disorder that results in patches of thick red skin with the appearance of silvery scales. These patches can be found on elbows, knees, scalp, the lower back, face, feet, fingernails, toenails, and even the mouth. Psoriasis can be confused with other skin diseases, so a dermatologist is the best physician to diagnose psoriasis. Treatments may include creams, ointments, ultraviolet light therapy, and medication. Injuries. Because the skin is the part of our bodies that meets the world most directly, it is especially vulnerable to injury. Injuries include burns, wounds, as well as scars and calluses. They can be caused by sharp objects, heat, or excessive pressure or friction on the skin. Skin injuries set off a healing process that occurs in several overlapping stages. The first step is repairing damaged skin in the formation of a blood clot that helps stop the flow of blood and scabs over with time. Many different types of cells are involved in wound repair, especially if the surface area that needs repair is extensive. Before the basal stem cells of the stratum basale can recreate the epidermis, fibroblasts mobilize and divide rapidly to repair the damaged tissue by collagen deposition, forming granulation tissue. Blood capillaries follow the fibroblasts and help increase blood circulation and oxygen supply to the area. Immune cells, such as macrophages, roam the area and engulf any foreign matter to reduce the chance of infection. Burns. A burn results when the skin is damaged by intense heat, radiation, electricity, or chemicals. The damage results in the death of skin cells, which can lead to a massive loss of fluid. Dehydration, electrolyte imbalance, and renal and circulatory failure follow, which can be fatal. Burn patients are treated with IV fluids to offset dehydration, as well as intravenous nutrients that enable the body to repair tissues and replace lost proteins. Another serious threat to the lives of burn patients is infection. Burned skin is extremely susceptible to bacteria and other pathogens due to the loss of protection by intact layers of the skin. Burn classification. Burns are sometimes measured in terms of the size of the total surface area affected. This is referred to as rule of nines, which associates specific anatomical areas with percentage that is a factor of 9. Burns are also classified by the degree of their severity. A first-degree burn is a superficial burn that affects only the epidermis. Although the skin may be painful and swollen, these burns typically heal on their own within a few days. Mild sunburn fits into the category of a first-degree burn. A second-degree burn goes deeper and affects both the epidermis and a portion of the dermis. These burns result in swelling from a painful blistering of the skin. It is important to keep the burn site clean and sterile to prevent infection. If this is done, the burn will heal within several weeks. A third-degree burn fully extends into the epidermis and dermis, destroying the tissue and affecting the nerve endings and sensory function. These are serious burns that may appear white, red, or black. They require medical attention and will heal slowly without it. A fourth-degree burn is even more severe, affecting the underlying muscle and bone. Oddly, third and fourth-degree burns are usually not as painful because nerve endings themselves are damaged. Full-thickness burns cannot be repaired by the body because the local tissues used for repair are damaged and require debridement, or amputation in severe cases, followed by grafting of the skin from an unaffected part of the body, or from skin grown in tissue culture for grafting purposes. Skin grafts are required when the damage from trauma or infection cannot be closed with sutures or staples. Scars and keloids. Most cuts or wounds, with the exception of ones that scratch the epidermis, lead to scar formation. Scarring occurs in cases in which there is repair of skin damage, but the skin fails to regenerate, or the original skin structure. Fibroblasts generate scar tissue in the form of collagen, and the bulk of repair is due to the basket weave pattern generated by collagen fibers and does not result in regeneration of the typical cell structure of the skin. Instead, the tissue is fibrous in nature and does not allow for the regeneration of accessory structures, such as hair follicles, sweat glands, or sebaceous glands. Sometimes there is an overproduction of scar tissue because the process of collagen formation does not stop when the wound is healed. This results in a keloid. In contrast, scars that result from acne and chickenpox have a sunken appearance and are called atrophic scars.